Okay, so I think we're going to go ahead and get started. Um, First of all, let me introduce myself. My name is Jill Matson, and I am a pediatric nurse practitioner and the clinical specialist and navigator manager for the Autism Alliance of Michigan. And I just want to welcome you to our third town hall series that we have done over the past month or so on transition. And so tonight we're going to talk about healthcare transition for youth with autism. So certainly glad that you're all here. And we have some really great panelists that I'm going to introduce shortly. And I think we have some really great questions that we're going to get into, and I think generate some really great discussion about healthcare transition and how we can sort of, prepare parents and caregivers and individuals with autism to sort of make that transition from pediatric primary care providers to adult providers. So, for those of you too, I just wanted to share a little bit. If you're not familiar with the Autism Alliance of Michigan, I know some of you may be, but if you're not, just wanted to give you a little bit of background in history on our organization. We are a nonprofit organization that serves the entire state of Michigan. And our mission really is to improve the quality of life for individuals affected by autism across the entire state and across the entire lifespan. So we do that with a variety of different approaches. We do a lot of advocacy work. We do quite a bit of community outreach and education, similar to what we're doing here tonight. We will work with families, with individuals who have autism, with professionals who interact with individuals on the spectrum, educators, again, just sort of offering lots of education and community outreach. We also focus a lot of our efforts on inclusion as well. And to do that, we have a variety of different programs. We have an employment program, it's called Upbound at Work, where we work to kind of pair individuals on the autism spectrum who are looking for work or employment with companies who have open positions where that might be a good fit. And then providing them with some job coaching as well, and help with resumes and getting through interviews and things like that. We also have a program called the Navigator Program. Some of you may be familiar with it. But our Navigator program is sort of our pillar program, and it essentially is free case management services for families and individuals. And even we are helping professionals too who contact us about anything autism. We can, help individuals that are looking for diagnostic evaluations for their 3-year-old. And then we also have families and individuals calling who are, adults looking for housing or transportation or help securing employment. And then sort of everything in between. And we have navigator staff who are very well educated and very experienced in autism in a variety of different areas, clinical backgrounds, educational backgrounds, therapy backgrounds, who serve as our navigators, and they continue to kind of work with families and individuals who contact us to sort of help give them some direction, answer some of their questions, sort of navigate some of the challenges that families and individuals with autism face. So it's an amazing program, and like I said, it's statewide and it covers sort of the entire lifespan. And I'll share with you our contact information afterwards. So if any of you sort of after our presentation tonight still have some questions, some specific questions maybe that relate, to your specific situation, or questions maybe that we weren't able to answer tonight, I'll give you that contact information. We'd love to have you reach out to us and speak with one of our navigators, and we can certainly help, get some of those questions answered for you and kind of get you pointed in the right direction. We also have some additional kind of fun community events that we do every year. We have a walk that we do at the Detroit Zoo that's really, really fun, where families can come and sort of spend the day at the zoo. And we just have a lot of fun activities and different vendor tables for families with information. We do a yearly gala once a year. Some of it's been a little bit challenging, and dates and times have been moved around a little bit because of COVID this year. But again, those are things that we typically do every year. We typically will do two parent conferences a year. We usually do one in the fall and one in the spring. We were able to get the one done in the spring right before sort of all of the COVID restrictions went into place. And we're planning on doing one, probably a virtual one this spring. So you can certainly kind of keep your eyes out for that. But yeah, we do a lot of great work here. And I would encourage you, if you haven't been to our website, visit our website. And then, like I said, if you have questions or other things that we can help you with that we maybe don't get to tonight, please feel free to reach out. Like I said, I'll give you our contact information at the end of the talk today, and then you can reach out and get in touch with a navigator. Okay, so let me, I think next what I would like to do is we'll go ahead and introduce our panelists. As I mentioned earlier, we have some really great panelists tonight, and want to introduce them. First, we have Dr. Richard Solomon, who is the medical director at the Ann Arbor Center for Developmental and Behavioral Pediatrics. And Dr. Solomon, if you want to just share a little bit about your background and what you do, and your experience in working with kids and individuals on the spectrum and their families.
Well, thanks so much, Jill, for doing this. I appreciate it. So again, my name is Rick Solomon. I'm a developmental and behavioral pediatrician and the medical director of the Ann Arbor Center for Developmental and Behavioral Pediatrics. And I've been in Michigan for 20 years now, going on 21 years. And my practice is primarily focused on children with autism. I have the whole range, but as I was telling Jill before we started the conference, I have been doing this for 20 years, and so a lot of my quote children are now adults, and it's been a fascinating process to really watch the life course of children's development. The other thing that I do is I run a program. I'm the medical director of a program called the Play Project, which serves especially young children with autism by empowering parents, by training parents to help their children through a play-based approach. So, so that's my background. Thank you.
Great, thanks for being here. Our next panelist is Dr. Tisa Johnson, and Dr. Johnson is a pediatrician and the medical director at the Center for Autism and Developmental Disabilities at Henry Ford Hospital. So Dr. Johnson, again, if you can just share just a little bit about your background and again, sort of your experience in working with individuals and kids on the autism spectrum and their families.
Certainly. Is my camera on?
Yeah.
Okay, perfect. Oh, nice to be here. Thank you for having me.
Yeah.
So my name is Dr. Tisa Johnson Hooper. I'm a pediatrician at Henry Ford Health System in Detroit. I'm at New Center 1, and am also the medical director for our Center for Autism and Developmental Disabilities. So my background in working with kids with autism actually predated our autism program at CAD. I started working at Henry Ford gosh, now 20 years, so it's aging me, but started right away working with a group of kids with special healthcare needs. It's always been my passion to work with kids with special healthcare needs. And over time, as I began my work as the medical director for our autism program and working in our multidisciplinary evaluation center, have gathered more kids in my primary practice with autism. So my focus is providing a medical home approach, a comprehensive, coordinated, family-centered approach for caring for kids with special health care needs. My kids too, like Dr. Solomon, have grown up, and that has really launched my interest in cultivating a comprehensive way that I can instill healthcare skills to my young people so that they can be able to manage their own health as they become young adults.
Great. Well, thanks for doing this tonight. We're happy to have you. And then our next panelist is Dr. Muhuddin. She is an assistant professor in the Department of Child and Adolescent Psychiatry at Michigan Medicine. So again, if you can just share with us a little bit about your background and your experience with individuals and families on the autism spectrum.
Sure, yeah, thanks for having me. So I'm Sarah Muhuddin. I'm a child and adolescent psychiatrist at the University of Michigan. I also serve as the director for the multidisciplinary autism program within Michigan Medicine. And on top of that, I serve multiple roles. So one obviously is in evaluations and diagnosis of children and adolescents with autism spectrum disorders. I also serve as the training director for child and adolescent psychiatry at the University of Michigan. So in that role, part of my job is to train other physicians to take care of individuals both with autism spectrum disorders and developmental disabilities of all kinds. And that includes training pediatricians, pediatric neurologists, family practice physicians, as well as psychiatrists. In addition to that, I myself have several family members who are now, in adulthood. So an aunt and an uncle with significant developmental disabilities. And so on top of kind of understanding that in my clinical life, I also have a lot of personal understanding of what it means to live with someone, love someone, and care for somebody with significant challenges and strengths. And part of my interest too, just like the other physicians on the call have said, having taken care of people as they've aged into adulthood, is thinking about that transition and what it means to take care of adults with autism spectrum disorders. So I'm really excited for this tonight. Thank you for having me.
Yeah, again, thanks to all of you. I'm really excited to have you here, and I think we're gonna, I think it'll generate some great discussion. So let's go ahead and get started with our first question. And sort of the way that the format is going to work is we pull together a variety of questions that sort of came through when people were registering for the seminar. Questions that have come in through our navigator line that were sort of common questions among caregivers and parents who had kiddos that were sort of entering into that transition stage. And so we tried to pull some of the ones that were the more common ones that we thought would be most helpful. And so we'll kind of go through and each one of these questions, and then we'll have one of the panelists will answer each one of the questions. And then again, if anybody has any other questions or comments, you're certainly welcome to share them in the chat. We'll be monitoring the chat box as well. If we can, we'll try and pull some questions from the chat box. So we'll go ahead and get started with our first question, and this is for Dr. Johnson. So what is healthcare transition exactly? And at what age should my child and I start planning for transition to an adult physician?
So The term healthcare transition, it does not represent like a discrete time, a discrete age. It really is a process. So it's a process of planning and preparing for that young person to go from that pediatric approach of healthcare to an adult approach of healthcare. So this does not mean that the child has to necessarily change providers, because there are family medicine doctors that take care of the lifespan. It really speaks to the approach, how healthcare is going from the provider talking to the parent, maybe along with the patient, depending on their age, to where that young person takes on responsibility and understanding their health and advocating for them for their own health care. So the age that this process should begin really should be at early adolescence, around 12 to 13. This process should begin.
Great, thank you. So question number 2, this is for Dr. Mohideen. Why can't my child continue to see their pediatrician when they become an adult? And why is it important to transition to an adult provider?
So I'll echo some of the things that Dr. Johnson said earlier. So again, I think, one thing that I would tell parents to clarify at the beginning is who their primary care physician is and what their office or practice generally does for how long they follow a patient for. Because these things actually tend to vary. And even though the American Academy of Pediatrics has put out over the decades various ages at which they suggest that pediatric patients begin transition, a lot of practices actually have their own approach to when they begin transitioning. So there are some pediatricians who may say that that has to be exactly at 18. There are other ones that say it's 21 or 22 or 26. So there's actually a wide range at which people actually do transition as a provider. So actually I would say for a parent, the first thing you need to do is what does the practice that you go to, what do they do? And begin to have that conversation like Dr. Johnson was saying, and thinking about it beforehand. And then this question of why do they need to transition? So I spoke a little bit to the fact that the practice that your child is being seen at may actually require you or kind of stress transitioning at a particular age. But what are some of the benefits, I think, to transitioning to an adult provider? That to me really is the question. And so I can see a couple different things is what I've seen for my patients and for my family members. So, the first one is, as our children or our loved ones or our patients begin to get older, the way that they want to engage in their healthcare changes. So, I see many of my own patients who are 16 or 18 or 20 or 22, and they want the approach to be different. They see what's going on with their siblings or family members or friends, and they want to see that their life too is making similar transitions. So you may have a child who is looking to have a more kind of adult type experience. Now, there may be other children or loved ones who may not understand or see or feel the need for that difference. So what would the benefit be for a child or a patient like that? The benefit there is that physicians and providers who primarily take care of adult patients generally have more experience or knowledge or awareness of both medical conditions that are common in adults and systems of care that are involved with taking care of adults. So whether that's, being hospitalized as an adult, getting lab work or blood work as an adult. So some of those kind of practical differences to approach to healthcare, your primary care physician is kind of, works alongside you in helping you navigate those things. So if that provider primarily takes care of adults, they would be more likely and able to guide you in doing some of those processes. And then also just awareness. Like I'm thinking about a patient of mine who, had kind of developed symptoms and couldn't really figure out what they were, and they were in their 50s. And I'm really thankful that they had an adult primary care provider who really understood how to assess pain in an adult who has significant communication challenges. And so that person was really able to do that, and then was able to help the family navigate, like getting kind of more invasive testing like is required, getting them hospitalized, et cetera. And then the follow-up afterwards. So all of those things, because the provider is an adult provider, was better able to help the family and serve the needs of the patient.
Yeah, those are some really good points. Thank you so much for sharing that. This is a really common question that we come across quite a bit. So let's move on. Our third question is for Dr. Johnson. And I think she had kind of alluded to this a little bit a few minutes ago. My child's doctor is a family medicine physician who will continue to provide care for my child as an adult. Do we still need to plan for healthcare transition?
So I just want to take a step back and I've talked a little bit about that healthcare transition as a process, but I think what I really want to make sure I'm clear what this process entails. But regardless of who's seeing that pediatric age patient, whether it's a pediatrician or a family medicine provider, both need to engage in specific roles to help that young person cultivate and develop skills so that when they become an adult, they have these skills to best care for themselves. And so even in family medicine, I think that family medicine provider needs to help plan to make sure that that young person develops those skills, and the approach looks different as they get to an adult. I once asked a bunch of family practitioners, how do they know when it's time to transition? What steps are in place? And it was really interesting. I actually had an adult provider tell me, well, when he sees his kids through adolescence, he realizes he needs to start treating them like when they no longer wanted the stickers that he hands out. Well, and that's what told him he needed to now start treating them like an adult. And so an adult or family medicine provider that's going to see that young person through childhood, adolescence, and adult medicine, they need to prepare that young person to what it's like to ask their own question, make an appointment. They need to help them understand what medicines they're in, how to refill those medications, who to call in case of an emergency. And these are things that young person is going to develop these skills over time. So even if it's a family medicine doctor, once that young person is now an adult, they have these skills that they've been working on, and that's a part of healthcare transition. And it doesn't matter whether they're family medicine or pediatricians, they need to work with that young person so that they develop these skills. So when they become an adult, they're able to actually use those skills to advocate for themselves and get their own health care.
Thank you. Okay, so we'll move on to question number 4, and this one is for Dr. Solomon. How can I best prepare myself and my child for transition to adult healthcare?
Well, that's a really important question because, as I think everybody realizes, most children with autism don't like change. They don't like change a lot, and I think this is one of the reasons why it's important to start at least talking about the transition. But so much depends on the developmental level of the child. Mm-hmm. So, if the child is really not that aware of time, I think I'll start with the children who may not be as aware of the transition as a phenomenon. So in other words, there's a lot of kids with autism who are lower functioning, who don't know that there's going to be a transition. Those children have to be prepared a lot differently than the children who are more aware of time and differences. And so, well, you know, one of the things that I recommend for the patients of mine who are moving in the direction of adult care is for them to actually go through a series of experiences that make them familiar. So you can break this down to making a visit to the building, and then making a visit to the front desk, and then making a visit to the doctor, and so that there's a very systematic desensitization process that goes on. You can go on the computer and you can show like other doctors to a child and say, we're going to be going to a new doctor, and use the same terminology and the same framework, and really help the children to adjust to this idea, even if they can't understand time. There's kind of a tone, and there's an expectation. And I mean, this is very hard. I think it's really hard for a lot of families and a lot of children to change somebody that they've been trusting, for 15 to 18 years. And they don't want to change necessarily. The children, many of them don't want to change. And especially those children who've gotten really comfortable with their doctor. So I think that's one group. There's a group of children that just, you're going to have to be much more thoughtful and planful and sequential, and kind of gradual, and and for those children, as you transition to an adult provider, that provider better be sensitive to the developmental characteristics of the child, and not necessarily treat that child like an adult. The developmental aspects are really important, that a physician should still be sensitive to the real needs of the child based on their developmental profile. So that's to me really important. Then you have a group of children who are really moving in the direction of being ready, who understand what it means. I think there's a large group of children who get very anxious about changing to a new doctor. And for those children who are aware that there's going to be a change, you can do the steps that we talked about for the first group of children by gradually going to visit the place, visiting the doctor, but then returning to your regular doctor and saying, this is going to be your new doctor. I think I love there's family practice doctors, I think, in my opinion, tend to be the better group to handle transitions, because they're really familiar with the broad range of ages. Med peds is good too. I would just warn parents, to be careful that when you transition, is that physician really familiar with the group? I think there's medical reasons to do the transition, but where maybe an internal medicine doctor might be the right doctor medically speaking, or psychiatrically speaking from a medication standpoint. But once again, I would really emphasize the importance for parents of having a doctor who is sensitive to their child, reads their child, is familiar with autism, which I think is very, very important, and is ready to handle the anxieties, the lack of familiarity, and to really deal with the person at their right developmental age. And then the third group, and I have many of these children who are fairly high functioning. And I think very early, they start to recognize that they don't want to be treated like a little kid. And they are developmentally making a lot of progress. And you can have full discussions with them about their future. And that group, you know, is probably less at risk for upsets or for feelings of anxiety. Although, once again, transition for children with autism is usually fraught with anxiety. And so, once again, I still think there should be, like Dr. Johnson was saying, a kind of a transition time to getting the children familiar with it. You know, yeah, so those are the big issues that I wanted to cover on this question. And then just the last thing to say is that how do I best prepare myself? Because you know what, parents get really attached to their child's primary care provider, and I think all children read their parents, and they can, if the parents are anxious about the change, and so I think the parents have to prepare themselves psychologically for the transition, and to be fully convinced that the transition is important, and they transmit that message to the children, and then the children feel that, okay, this is going to happen. My mom, my dad really want this to happen. That feeling gets transmitted. So I think the parents have to prepare themselves indeed to make these kinds of big, you know, I think this is a big, you know, transition in the life of the child.
Yeah. Thank you so much. So we've had a few questions come in, and Dr. Solomon, you can answer these, or Dr. Mohudeen or Dr. Johnson. We had, I think this one question sort of relates a little bit, I think, Dr. Solomon, to what you were talking about in terms of really understanding where an individual's developmental level is, even though they may actually be sort of adult age. And the question was, you know, what if your child has some significant, you know, cognitive impairment or mental impairment, and we know for sure that, you know, this is probably an individual that's going to need some significant ongoing support, even in you know, a medical setting. Like, how do you sort of approach those types of situations?
Should I start with that maybe?
Sure.
Yeah, so this really goes back to the principle that I mentioned earlier, which is the principle of developmental sensitivity in every which way. I mean, this is kind of an area that I've been involved with. How do we connect to the children in a way that's friendly and playful and engaging and meaningful, and based on the child's developmental level? And so those children who are, and I must say, I'm against what we call ageism. I don't believe that everybody should be related to based on their age. I believe that people should be related to based on who they are and their developmental level. And so you can have a 17-year-old who cannot anticipate the future, and whose interests are like those of a younger child. And so the developmental interests and level and capabilities of the person must be taken into consideration during these important transitions.
Can I add a couple comments?
Absolutely, absolutely.
Yeah, everything Dr. Solomon is saying is I agree with wholeheartedly. So I actually kind of want to reiterate his point of like creating scenarios and practicing them. And I was looking at one of the other comments in the chat about an ER visit and a tetanus shot, and it reminded me of this idea of preparing for a wide range of scenarios that are medical in their nature, right? So I think that's one piece where, you know, a child may be high functioning or, you know, cognitively like at or above level, but then their ability to engage around like medical conversations or medical decision making may be different. In particular, when you have other things like psychiatric overlay kind of playing a role. They mentioned anxiety in with shots. So these are where kind of to piggyback on what both Dr. Johnson and Dr. Solomon was saying, like beginning early, thinking through like what are the different scenarios, especially as you're planning towards medical power of attorney or guardianship. Like there are many different levels that could take, and there are a variety of different scenarios in which decision making may be primarily with your child or primarily with you or shared together, and thinking through those things. So I think like practicing, like Dr. Solomon was saying, like practicing like going to a doctor's office, but also practicing things like initiating the conversation with your physician or like the clinic nurse or MA if you're worried about something. Or like thinking through, like say it's not that if your child is at the developmental level where they themselves cannot have that conversation, thinking through for you as a primary caregiver, you know, what are the things, you know, when your child is 18 or 20 or 40 that you're going to be playing a role in. And or like the other kind of more challenging thing I think for families to think about is what happens if you aren't available? Like who are the other people, you know, in your line who would be helping either you or your child in some of these decisions or scenarios. And it's important to think about those things in advance.
Can I just weigh in really quickly?
No, absolutely.
I love everything that was said. And I think I want, in full disclosure, I'd like to share with the listeners, parents, that not only do parents and young adults need to prepare for this transition, but providers have a huge responsibility as well. And the reality is most adult providers do not have a wealth of experience in caring for young adults with autism spectrum disorder. That's the sad reality. So when parents ask what are some key things that they need to do to best prepare their young adult for that adult approach to medicine, whether it's their family practitioner, pediatrician, or internist, is identifying a provider as early as possible and asking very simple questions. Do you have experience caring for young adults with autism? They may say no, but providers are willing to learn. I think my follow-up question, if they don't have a lot of experience, is ask them, would they be willing to partner with you if the child is not able to care for themselves completely independent of a guardian, or partner with this young person so that the adult provider can learn about autism. I'll just share really briefly what really initiated my interest in this area. Years ago, I looked up and I had a large cohort of patients with special needs that were well in their 20s. Well, I'm a pediatrician and caring for a 28-year-old, a 29-year-old with specific healthcare, special healthcare needs. I looked up and was like, I'm not an adult provider. I've got to do something different. So I did reach out to a few of my adult colleagues and would say, I had some of these patients I need to transition, and I did a really poor job of preparing my families. I just pretty much said, well, you're an adult now. You know, I have this great physician I want you to see, kind of gave them my little spiel, and the parents would go off to see the adult providers. I followed to see really what happened. And I had a large number of families that I referred on that didn't take my recommendation and referral and didn't follow up in adult medicine. I had a large group that did go to the adult provider, but circled back around and made an appointment with me. And when I asked why they did that, they pretty much told me, well, this really wasn't a well adult exam. They didn't, for instance, weigh my child, or they didn't, my child didn't have to get disrobed. And these were kids with significant cognitive impairments where parents were involved in their day to day. And that's where I realized the approach was so very different. And I needed to do a better job of preparing and giving a lot of anticipatory guidance of what a well child care looks like in adult medicine. And it's very different than what we do in pediatrics. I actually learned that I needed to do a better job of making sure the adult provider was well educated about the young person. My parents said we didn't want to go to someone who knew nothing about my child. So it really showed me there was a lot of barriers, not just for the child and the parent, but on the provider. We needed to have a better process in place, so that when, as a pediatrician, I launched my young person into adult care, the adult provider was there to receive them, knowing about the healthcare, knowing how to access whether or not the young person could be independent or needed supports in place, knowing about their diagnosis, whether it's autism, intellectual disability, a comorbid mental health issue. They needed to have that information, and training needed to occur. So there's a lot. I said a lot I want to unpack, but when parents ask what are the best things I need to do to help prepare my child, is making sure whoever's going to be receiving your young person has preparation and has knowledge about your child in advance.
Yeah, thank you so much. Those were all really good points. Anything else any of you want to add to this?
This one participant said that she had trouble in the emergency room. Yeah. I think that's a good example of what I was talking about. If you're not prepared, I mean, this is one of the things that I did in my life was help children with cancer get through painful procedures. I spent years doing that at Michigan State University, and actually worked with Mr. Rogers to write a book to help kids go through painful procedures. And one of the big things that I did is to help the child be prepared through practice. And so this is a good example of what I was talking about earlier, is that you want to practice the transition, you want to practice the experience, you want to talk about the experience, you want to have the child be as familiar as possible. I think Dr. Johnson's point is very well taken. It kind of as a corollary to what I was talking about, is that the physician should be sensitive to the child, which means developmentally sensitive. And I think that if you go into the emergency room and the child needs an immunization, there is a way to talk the child down from their anxiety and to help them understand and to help them be prepared. If you're patient, if you're sensitive, if you're knowledgeable about how to talk with children at whatever their developmental level is. And so who your receiving physician is, I think Dr. Johnson's point is really well taken. Personally, my experience has been that family practice does the best job of that. But there's nothing to say that you can't interview these doctors ahead of time and get a feel for them. And I trust parents' intuition. I mean, you interview the families, and you interview the doctors before you do the transition. You see what they know, what they don't know. I think the other big factor that Dr. Johnson also mentioned was just the importance of responsiveness to the parents, willingness to change, ability to adapt. Those doctors who are flexible, open, responsive, to me, that those are really important qualities. They don't necessarily have to know a lot if they're willing to learn,
Yeah, for sure.
because there aren't a lot.
Yeah. Anything else either of you want to add before we move on? That was some really, really, really good information, I think, for families. Okay, so let's move on to our next question. And this question is for Dr. Muhyiddin. How can I find an adult primary care provider who will be a good fit for my child? And this is probably the one of the big number one questions we get quite a bit. And I think some folks have even mentioned this a little bit in the chats that have been coming in, the comments in the chat box. Are there primary care providers that specialize in caring for adults with autism?
So I can speak to these questions, and I'm sure the other panelists can weigh in as well. So, so I would say, where can you find an adult primary care provider that is a good fit for your child? I think there are a number of different places where you can get good recommendations. So I would say the first place to start actually is with someone that you know and trust. And so that person could be your current primary care provider. So like Dr. Johnson was saying, those of us who primarily take care of individuals on the autism spectrum, we know a lot of the other doctors who we share patients with, people with whom the experiences have gone well or have not, or have collaborated with them together. Just as Dr. Solomon was mentioning, I actually also do prefer to send many of my patients as they transition to adulthood to family practice physicians, because they do have a wide range of experience across development, from early childhood to young adult transition age up until geriatrics. So just in terms of thinking through, like, how many more transitions would a child potentially have to go through, transitioning into a family practice office may potentially decrease those numbers of transitions. The other places that I think are a good place to get information is a place like the Navigator program, right? So the Navigator program will have information for families in various parts of the state. And I think that's usually a more challenging situation, is when you live in an area where there isn't a wide range of providers, or you're limited by insurance. And this is really where the Navigator program can be even more helpful, because they have knowledge and awareness of these kind of more unique situations. And then to answer this question, and then I would also say, another place that for families, I feel like is a good resource is thinking through transition age programs in your particular school district, right? So in your school district, there are some children that will continue to receive services up until the age of 26. Your child may or may not be in that cohort, depending on their cognitive and developmental level. However, there are always going to be in a school district a set number of kids who do, right? So, communicating with that program on who are the providers that some of those families or children utilize or seek services from is another good resource. Are there primary care providers that specialize in caring for adults with autism? So in contrast to pediatric subspecialties where developmental behavioral pediatrics, child psychiatry, and pediatric neurology kind of shares the bulk of individuals on the spectrum, there is not a similar equivalent in adults. There are a large number of neurologists who take care of individuals on the spectrum, even though they are not primary care providers. But one difference that I think that you see in adult care is that often the specialists serve in a primary care role as well. And we know that happens in childhood too. There's no special certification or designation specifically that exists. And I think that's what makes it a little bit more challenging.
Anybody else? Dr. Solomon or Dr. Johnson, any other suggestions or recommendations for families who are looking to find a good adult provider?
I refer them to you, Jill.
Yeah. So, so again, I had mentioned it kind of at the beginning of of the program tonight, but it's one of the things that we sort of pride ourselves on, and we spend a lot of time sort of networking and building those connections, not only in sort of the Metro Detroit area, but across the entire state, where um, we'll talk a little bit more about this in terms of maybe some questions and things that you can and should be asking when you are looking for, even perhaps interviewing a physician to see if it is going to be a good fit for your child. But it's something that I will do as a clinician, and I will help sort of our navigators do that as well. And sometimes we can help bridge that gap and lay some of that groundwork, and may even reach out to certain providers that we think might be a good fit, and sort of talk to them and make some phone calls ahead of time for you, and say, this is a particular individual, this is the situation, this is the family, um, and kind of talk to them about what their experience is, and what their office is like, and staff that are in the office, and just different things that we think might be helpful, where we can sort of then maybe kind of identify or flag those providers as sort of people that are good to refer families to. And that's really what we do. We sort of have it's not a large list, that's for sure. But we do have some physicians who we, use quite a bit when we do have requests for families looking to sort of make that transition and move to an adult provider. And again, I think similar to what some of our panelists have mentioned, in my experience with that as well, has been that I tend to have better luck with physicians who are like family medicine physicians, or who are med peds physicians as well. I tend to have better luck with that. But with that being said, I mean, there are even some physicians that we have referred to who just, I think, similar to the situation that Dr. Johnson mentioned, where they just found themselves in their adult practice being, faced with patients coming in who had developmental disabilities, or who were on the autism spectrum, and they just weren't quite sure how to help them, or how to manage them, or how to take care of them. And so they just had a really strong interest in wanting to be a better physician, and wanting to take better care of those patients, because they weren't few and far between. And so they sort of, reached out, and made an effort to sort of kind of take on some more of those patients. So it's definitely something that we sort of approach on a case by case basis, because again, it is going to sort of depend on the situation and a particular child and family, and sort of what is going to be a good fit. But we can certainly help with that. Again, like I said, we just reach out to a navigator if you find yourself in that specific situation, and you're just not sure kind of where to go or where to start. And yeah, we can certainly work with you. We've worked with many families who are sort of in that predicament as well, and try and make that as smooth of a transition as we can.
What about parent to parent?
Yeah.
Do
So
you
that's,
connect
yeah.
parents to other parents in a given region or community?
Yeah, no, I'm glad you brought that up. So that's actually another thing that we do is parent to parent. So parents who have had a good experience with somebody, and that's also how we sort of tend to add to our own list of physicians or resources that we may recommend. If we have a family who has had a good experience, has developed a really good working relationship with a clinician, and they're really, really good, we will take those sort of firsthand recommendations, where we can then say to other families, I've worked with several other families who have gone to this physician, and these are the things that they've said. This is, these are the things that they found that they really liked, that really worked well. And so, yeah, we definitely will tap into that as well. And that's kind of how we sort of have to do it. It's really just by, word of mouth and kind of some groundwork and making some initial phone calls and asking some questions, and just kind of building that network little by little as we go.
And Jill, I would want to add, I think that is perfect, and that the process that you laid out. I would add also, it is important, even with the recommendation from other families who've had great experience with the provider, to still pick up the phone and ask the question. And I'll tell you, because I've been burned in that, I found some amazing adult providers that did great work in taking care of my kids. And so naturally, I continue to refer them. Finally, one just picked up the phone and said, I appreciate the recommendation, but your patients are too much. I can't handle anymore. Yeah. And that got me thinking, it's my passion, and I love my entire practice to be those young folks with special healthcare needs. An adult provider may not mind taking on a couple, but when they feel like their word of mouth gets out there, that's how your practice builds. And they may be reluctant or resistant because they have other populations that they may, need to serve equally. And so I've always, even though I know of a great doctor on the East Side, I will pick up the phone and say, are you willing to take one more of my kiddos?
Yeah,
that's really important.
For sure. No, that's a point. That's a point well taken. And I have had that happen as well, where, again, they're very grateful and very thankful, but, they sort of tend to get overwhelmed as well. And so, again, I think that's why what I found is that it really is kind of, we sort of, at least through our navigator program, when we have families that are asking for help in this area, it really is kind of a case by case basis, and it's going to be unique for every family and every child. Again, like, to Dr. Solomon's point, a 22-year-old can be very different in terms of their developmental level. And so what worked really well for one 22-year-old on the spectrum might not be a good fit for another one. And so again, I think it's just, we can absolutely help give you some guidance and direction and point you in the right direction and maybe narrow it down and help make some phone calls and sort of help educate families to know what questions they should be asking as well. So that's definitely something that we can help you with, but it's definitely not an easy task. And I think I think to Dr. Solomon's point too, I think, kids get very attached to their pediatricians, parents get very attached to their pediatricians get very attached to their families and their patients. And so it's really, it's not an easy transition always to make. So just, I think having those conversations and those dialogues. And I think, as a clinician, to what, Dr. Johnson had talked about is that, you want to sort of make that handoff, and you want to make sure that, your patient who you've, spent so many years taking care of, you want to make sure that they're going to be in good hands, when you make that handoff. And so I think for physicians and clinicians that can maybe just take those extra couple steps to make sure that, we're getting families and patients to sort of a good place for that sort of next phase of their health care. So
I just had another thought that I think is really important in terms of advocating for parents, advocating for their child. I think that I found some of my families prepare me for who their child is. Mm-hmm. And I find that to be really helpful. So I think that there's this opportunity when you're going through the transition and you're interviewing doctors to also inform them about who your child is, what your child likes, so to actually help them understand what your child needs. I just wanted to mention that. I think I think profiling your child for the doctor that you're transitioning to is, I think, would be very helpful.
Yeah, for sure, for sure. Okay, let's, that was great discussion, some really great questions. So let's move on. And this talks, we touched on a little bit of this as well. But again, this question for Dr. Solomon, and the other panelists too can, jump in as well. What should I consider when selecting an adult primary care physician for my child? And we alluded to this a little bit and talked a little bit about it, but are there certain questions that that parents should be asking?
Yeah, so I actually started answering this question without knowing it. I think I mentioned these qualities that you're looking for, probably in any doctor, but I think it's more important when you're looking at transitioning your child into another practice, is a doctor who's open, who's maybe willing to learn, new things. A doctor who will take into consideration your child's developmental level and shows sensitivity to the child's developmental level, not just their age. I think in my experience, at least, the large majority, now this may be different for Dr. Johnson, but the large majority of my children who are transitioning are relatively healthy. And so but there's also a group of children for whom I am managing medications. And if I were to transition them to a primary care doctor, is one question I would definitely ask is, how comfortable is that doctor managing the current medication regimens that the child's on, and any type of, maybe a seizure disorder or issues related to their behavior. So you want to make sure that the doctor is prepared. So the questions that it says, are there certain questions I should be asking? I think familiarity with your child's condition. So those questions are important. They're not, I don't think those are deal breakers, by the way. I do believe that if the doctor is open and interested and warm and willing to adapt and learn, then they'll make the adjustments because you can connect that primary care provider with their specialist. But I think, and then the last thing I'll say is, I really trust parents' intuitions. They should interview this doctor and get a feel for whether or not they like the person or not, and they have a good vibe. That may sound a little squishy, but I really trust, especially the parent who spends the most time with the child, trust their intuition.
And I think one of the things I would stress with that is as a pediatrician, I try to make sure my families know, because it's different doesn't make it wrong. Mm-hmm. So when they're asking questions, I think it's okay to say, well, my pediatrician typically does, and fill that in. Are you comfortable doing that, or will you be doing it? And so a very practical example. I once had a mother give me feedback that she no longer wanted to see the internist that I referred her son to. And I asked why. And she said, well, for the physical, she had two issues with that he didn't weigh, her child was not weighed with the clothes taken off. And so in pediatrics, we tend to, we always have kids get undressed and we weigh, we measure all those vital signs. In this adult practice, that wasn't the case. And so that was very different for her. And she thought then the quality was off, and she was really offended. She was offended. I once had a parent become very upset with the new provider because I was the one who diagnosed and managed her young person's ADHD. When I referred them into internal medicine, our internist felt ADHD was a diagnosis that should be managed by behavioral health. And the mom thought the doctor was dismissing. And I should have done a better job to say, this is how ADHD is managed on the adult side. It's different, it's not wrong.
Mhm. Yeah.
And so that really helped me to make sure my families are aware of what the differences will be in an adult approach. And if that is a concern, they ask the question before the transition, so it's smooth.
Yeah. Yeah.
I was going to add a couple more comments. You know, Dr. Solomon was talking about parents trusting their intuition. I also think it's important to find a doctor that trusts yours as a parent. Because parents of kids with special needs or parents of kids with ASD, I mean, it may, you know, and it is, you know, all parents know their kids, but I would say that, you know, the parents that we work with and take care of, they're just special. Like they know every breath that's different, every tone that's different, every, you know, they just know everything. And so, you know, and that is what, you know, I think that leads to some of that anxiety about transitioning away from your pediatrician, because over time, your pediatrician really learns to trust the parents' intuition about a kid who may be difficult to examine, assess, figure out, understand. And so, and that is a little bit different with adult providers. So, you know, finding an adult provider who really is kind of looking to trust a parent's intuition is really important. I would say that's one thing. And then like related to that is that I have found that some adult providers really struggle with having parents involved. So, you know, a lot of times they're like, no, the kid has to like say everything and the kid has to make all the, and that may be technically true, but for many kids, especially as they transition, their parents or caregivers or siblings still need to be involved, right? So I actually take care of a lot of kids with special needs like at the end of life. And usually there's like parents and siblings and things like that involved with them. And it's interesting for me to hear from the adult providers how they perceive family members' involvement. And I think for those of us that take care of kids with special needs, it's so like, that's just how it works, right? Like the parents and caregivers are involved. So you need to make sure that the primary care doctor is okay with that model of that like family or caregiver involvement. And then the last thing I would add is that you do need a primary caregiver or a primary care provider who's okay thinking outside the box. I think that's like another important piece, which is, you know, that kids on the spectrum, they don't always present the same way with pain. They don't present the same way, you know, for like GI problems or headaches, or, you know, they don't have the same kind of medication responses or side effects. So somebody who is willing to kind of think that way and understand maybe that how a kid is presenting may not be typical, and be willing to kind of understand that and learn about that.
Yeah, one of the questions that has come in through the chat, I think is another good question too, and I'll open it up for each of you that would like to comment. What sort of would you recommend is the best venue or the best way to sort of go about, you know, interviewing a physician, a potential provider? Is it something you can do over the phone? Is it something where you should schedule an appointment with just, you know, yourself as the parent? What do you suggest or recommend is the best sort of way to go about that? And I guess I would suspect it might vary from clinic to clinic or physician to physician, but what are your thoughts or what have your experiences been with that?
Quick Zoom visit would be good.
I think it would be ideal if access were not an issue to go in and lay eye, not just on the provider, but the staff.
Yeah.
Right? The layout of the clinic. What what is, how do you drive? How do you access it? Do the whole walkthrough, if you will. I've actually created these meet and greets on the adult side for my young people to go and do a field trip, just like you do an orientation for when you're looking at colleges, right? Or looking at high schools. They're all different. Everything looks good on paper. So I would say in the ideal world, maybe after COVID, that I would encourage all families to go and do a dry run and do an interview, sit down, have your questions and answer. I had that happen on the pediatric side. We do that all the time for expectant mothers. They walk around, they want to see what the nurse is like, who's going to take, schedule their appointment. Are they welcoming? Do they have information and resources? Are they excited to see them? Those are little things that, as we were talking about before, it's just your intuition. Does it feel like home for you and your medical home, if you will? Ideally, that's what I would make that recommendation.
Any other comments before we move on?
Well, I was just thinking that you can make a first visit and it can be a tentative thing.
Mm-hmm.
You say, well, I want to come to your practice but I'm not making any commitments.
Yeah.
Mm-hmm.
I think that's fair to say. But I also am, I'm only half joking about it. These days, Zoom has opened up the possibility that you could have a 10-minute, meeting.
Mm-hmm.
Be interesting to see. I don't know. That'd be hard to pull off, I think, with a lot of doctors. But
I would add too that, it also depends on the type of practice. If the practice is larger, then it may be that the practice has a practice manager or a clinic manager. So that may also be somebody that you could ask to speak with. And there you would find out more about process, right? So like how do you schedule appointments? How do you contact? How are phone calls made back? How many patients in the practice do have, either similar kind of like either are on the spectrum or have like medical, cognitive, psychiatric conditions similar to the ones that your child has. How, Tisa or Dr. Johnson brought up the idea of controlled substances, like how do they deal with controlled substance prescriptions? So there are a lot of those logistical questions actually that a practice manager can answer even before you meet the physician. So you can kind of do some reconnaissance, right, before you actually meet the physician. So you kind of walk in already with a set of information. In that first conversation, you may already get that vibe that people are talking about, that this practice is not the right fit, right? So you may get that sense. It may save you the visit out to the physician. But yeah, I agree. You probably have to see them in person to really figure it out.
Yeah. So that's a really good point. I think too, it's important to ask about, just because sometimes I think it's just different when you're moving to an adult practice. I think a lot of maybe the accommodations that are made and like, I think as a pediatric provider, like we don't really think a whole lot about, but there are just lots of accommodations and things that we make for kids and for families. And so I think for some of individuals on the autism spectrum who have some developmental disabilities, again, that may still require some of those accommodations despite the fact that they're now an adult, and how open and willing is that practice going to be in terms of making some of those accommodations. And they could be just like really simple things, like things that I've had where an individual, like when they come into the clinic, they always are in room 3 or they're always in the dinosaur room. And it's really not a big deal. It's like we sort of know it, the chart is flagged, like, John always goes into room 3. Let's just put him in room 3 and it's a great visit. And so some of that may, I found carry over into some of that, like those adult settings. And so just some things like that are just some questions to ask about, without having to sort of maybe, unrealistic expectations where you're, turning the practice upside down, but maybe simple things like that. How open and willing are they to sort of, make some of those accommodations for your child might be good questions to ask as well.
I just had one other thought about, we really have not spoken too much about the higher functioning children. I think we've been cautious to say, well, we want to make sure that the children who need help get help, and that their developmental issues are sensitively addressed. But I was just recalling one of my patients who's now 17, and actually fairly high functioning. And I just wanted to say how wonderful it was to talk with her about what she wanted. And so I think there's this, I think I don't want to miss this to say that there's a group of children who are actually, they're young adults and adolescents, young adults, this is a great opportunity just for those parents who might have a kid who's really quite capable. To me, this is another one of those wonderful developmental milestones that these young adults can participate in the decision-making process of moving to an adult practice, and they feel adult and they want to make the appointment themselves. And this is one of these really wonderful opportunities for these young adults to feel more adult-like. I've always encouraged my parents to treat their children as full members of decision-making on their own as much as possible. I just think this is one of those opportunities. There may still be some anxiety there, but there's this really, I just wanted to speak to those parents who might have a child who's really higher functioning, and that this is a great opportunity to keep furthering their adulthood, if you will, and not to baby them and not to underestimate them, and to really give them power to participate in the decision-making and the discussions about it.
Yeah, Dr. Solomon, I just love that and resonate with that so much. I have one patient who I remember, like, the first time he started coming to his appointments on his own, he was 26, before his mom stopped coming into the appointment with him. I mean, she would still drive him and bring him, and she started by just being in the waiting room, and he would just come into the appointment and she wouldn't come in, to not even coming into the building. And just how powerful and meaningful that was for him to have that experience that was just his, that he's the only one that's talking to me and communicating with me, even though I do have to follow up with the mom afterwards to make sure, like, all the prescriptions are right and everything else is, but just the experience itself is so empowering and so important, I think, developmentally for so many of the kids and people that we help take care of.
Yeah, we just hadn't mentioned it. I just didn't want to leave that group out, that group that is empowered by the experience.
Yes, yeah, definitely.
For sure. Great. Okay, great. Fantastic discussion. So let's move on to question 7. This one is for Dr. Johnson, but again, for the other panelists, if you have something to add, definitely we'd love to hear your comments. How can a child's pediatrician help sort of plan for that transition to an adult provider? I think, Dr. Johnson, you had mentioned this a little bit earlier in terms of some of the things that you kind of started to do in terms of helping sort of make that transition, and what has worked for you and maybe what you might do differently. So if you could speak to that, that would be great.
I'm sorry, I was muted again. Oh. So the how is actually what I am really excited about. Like, how do we develop a process so that young people can transition successfully? And so I'm going to just quickly share what I've learned over the years with a lot of shortcomings. I I fell into finding a structured healthcare transition called the 6 core elements of healthcare transition created by Got Transition. And this structured healthcare transition, the 6 steps, really starts in early adolescence and goes all the way into adulthood. What is wonderful about the 6 core elements to healthcare transition, it explains not just the pediatric role, but the adult provider role in healthcare transition. Because we've talked a lot about the responsibility of the uplift, but on the adult side, there are very discrete roles and responsibility. And I've had over the past 5 years, the honor really of trying to take these 6 core elements to healthcare transition and integrate them into our large health system that is Henry Ford. And to Dr. Solomon's point about the broad array of developmental levels of young people with autism, the 6 core elements is intended for all young people, regardless of their mental profile, their complexity in medical care. This is a structure to healthcare transition that can be embedded in both primary care and specialty care, inpatient and outpatient. And it has roles for parents. So I think it's an amazing resource and tool for everyone to learn how to begin the process of healthcare transition. It starts, I said, at age 11 or 12, where you start with simply a policy around healthcare transition, a policy that a practice devises and makes sure families, patients receive it when they're 12. It's merely a contract of what to expect. As a pediatrician, what is my role? What's the patient's role? What's the parent's role? And when we go through this transition process together, what are our goals? What are we going to try to achieve in this practice? So it's a contract, if you will, a policy that is given out early. It has one of the core elements has the ability to evaluate that young person's skills, regardless of their developmental level. They're encouraging that we give an assessment, if you will. So in my practice, we have what we call a health skills questionnaire. And it merely asks kids a bunch of questions about what is their understanding of their own health. And then a group of questions, what is their understanding of how to use healthcare? We don't expect a 12-year-old to know all the answers, but what we do, it's a great way to begin the conversation. And we give that assessment at 3 points in time in adolescence, one in early, one in middle, one in late adolescence. So when you have that 13-year-old and they'll tell you, well, I don't know my medicines, I don't know where to fill it, that's just, we have a quick conversation and I give that piece of paper to the parent to say, okay, let's identify 1 or 2 things, opportunities we want to talk about today. And the next time Smoothly comes in to see me, we're going to want him to schedule his own appointment. So let's let him practice, let him see it, then practice it. The next time, let him do it. And so the 6 core elements has very discrete tools that providers can use and parents can use. One of the main core elements is obviously planning and preparation. So depending on the complexity of that young person, it helps give a framework of what is that planning, what should it look like? Do you need a care plan that's explicitly written out? When are you going to transition to primary care versus specialty care? Because the ages may be different. Some primary care practices may want to transition at 21. Some specialists that are accustomed to managing both the pediatric and the adult diagnosis may continue to see that young person throughout their 20s. It's all very different, but developing and cultivating that plan early is an important part of planning on the pediatric side. So I'm not going to, don't obviously in this forum have the opportunity to go through all of the 6 core elements. I just want to make sure I get that out there to all those that are listening and struggling and worried about how do I even begin this process. I would encourage check out the www.gottransition.org so parents can familiarize themselves with what healthcare transition, a structured, organized healthcare transition process could potentially look like. Even if your primary care physician has not integrated this process or practice, that's okay. You can go to them and say, hey, I've gone over this health assessment and I see some opportunities here that I really want to work on. Can you help me with the resources, skills by the time they're 18, 19 or 21, if it's developmentally appropriate for them?
Any other comments? Those were really, really great things. And I agree. And I think it is definitely on our list of resources, but the GOT transition resources is really amazing. So again, I would definitely encourage you to take a look at that. There's so much information and just a wealth of resources and tools and different things to use. It's a really great website to check out. So I would definitely encourage everybody to kind of scope that out if you haven't done that. Any other comments before we move on to the next question? Yeah.
I would just add, I think a piece that's challenging for parents and families around transition is that what I notice happens is like, it's a hard thing to do. And it kind of feels like way out there, like way in the future, so it's easier to kind of not think about it. And I actually think that makes it harder, right? So I feel like it's one of those things for families, kind of even in thinking about, for everyone who's present today, I mean, all of you are here because you're thinking about transitions and it's important to you, but there are many families for whom I think they kind of avoid thinking about it because it's hard.
Mhm.
So I think it's important, like Dr. Johnson said, to kind of give yourself in your mind a time frame for when you would begin thinking about it. And Dr. Johnson mentioned this way at the beginning, but I'll bring it up again because I think once a kid is 12, 13, it's time really to start thinking about it. If you haven't started, like at least beginning to plan. So, even like looking at the website of GOT Transition is a good first start. Looking at the checklist, it's a good first start. So, setting out for yourself as a family, I know many families come and talk to me about, just like the worry and concern of what's going to happen to my child in the future. What is it going to look like? They're thinking about all of these things, but maybe they're not thinking about this piece. And then when it comes, it feels so like surprising and shocking and stressful. And your provider may not be, if your provider is not one who thinks about transition like we all do, they may not be mentioning it either. So then when it does come up, it kind of surprises them. Right. So that's why, I had mentioned at the beginning, even talking to the practice that you're a part of about when do people usually transition, right? Because when they find that out, it'll give you a time frame to look towards of when is that transition coming. And not something to kind of like bury your head in the sand about and like not think, because it's coming. Right. So, what I tell families is like, when kids are like 6, we start thinking about puberty, like what's going to happen for puberty. When they're 12, we start thinking like, for the kids who are, like cognitively at average or above average, like could they drive? What is the future going to look like? In that same way, at that time point, you're going to be thinking about it. So when I think, you did that poll at the beginning about the age range of people who are here today, I would say that, there are some who may feel like it's early, but I'm telling you, it's not too early. It's just something you have to kind of push forward and think about. And it'll be helpful to your child in the end. Like Dr. Solomon was mentioning, it's, transitions are hard. So it's the kind of thing that you don't want to do suddenly if you don't have to. So I think you're muted, Dr. Johnson.
I'm sorry. I just want to say one of the things to definitely realize that when we don't have structured healthcare transition, and we don't in this country, we don't. But what we know happens is the quality of healthcare is compromised. And instead of young people getting their healthcare that is continuous and comprehensive in primary care, it is fragmented and it's typically been achieved through the emergency room in crisis, and it's not planned. And that's horrible. The quality of healthcare really is compromised. And many people will argue for the healthy child, this happens to, they very typically stop seeing primary care. You know, when they're off in college, it's not that big of a deal. And they circle back around when they're in their late 20s, very typically. But those young people with complex medical problems or developmental disabilities, they follow that same trajectory, and it's their health care that is most impactful. So when I looked at healthcare transition across various chronic illnesses, children with autism follow that same trajectory very typically and are seen in crisis in the emergency room when a comorbid mental health issue has not been adequately addressed, and they have no one to go to for help. So this really is important to maintain quality healthcare, because it's definitely an impactful situation for so many young people.
Yeah, and I think Dr. Johnson, to your point, you know, some of the things that that I have found or that I have heard from you know, from parents is that you know, to your point about it's not an easy transition to make, and it can, you know, as we've talked about here tonight, it can be hard to find somebody that's going to be a good fit. And so you know, many times you know, our kids with developmental disabilities or with ASD, once they sort of age out of that pediatric practice, it can be years sometimes before that they've even seen a clinician. I mean, it's not uncommon for family members to contact us and say, you know, similar to your point, where we've got an individual who has some very, very significant, sometimes even life-threatening medical issues that have not been addressed and managed properly. And when I ask when, you know, who is their primary care provider? Well, they don't have one. And when was the last time they were seen by a doctor? Sometimes it can be 5, 6, 7 years that they had even been seen by anybody. And I think too, some of it in terms of finding you know, a good person, I think some of it too is it can be even a little more challenging for those individuals who are maybe lower functioning, that maybe still have some challenging behavior problems. They're you know, grown-ups now, and so you know, that can be a little intimidating. It can be really stressful for the parents because you know, just getting them into the doctor's office, you're not sure what's going to happen in the waiting room and what's going to happen if they need to get a vaccine, or you know, all of those are very like real issues and definitely barriers for, you know, appropriate health care to continue into adulthood. And so I think to that point, it's really, really important to, you know, as we've mentioned here tonight, is to really, it's not too early to start planning. And it's sometimes this can be a challenging transition, but it can be done successfully. You know, if you're sort of knowledgeable and you know what questions to ask and you're starting early, and you're sort of committed to the process, I think we can make it work. But you know, I think to Dr. Johnson's point, if it doesn't happen, it can be, and I've seen it, I know we've all seen it, it can lead to some really detrimental results and consequences for, you know, some of these individuals that sort of get lost between that, you know, pediatric, you know, primary care setting, and then never sort of get the health care that they need, especially if there are some, you know, mental health or you know, medical comorbidities that are seen. So, okay, any other comments on question 7? Okay, so let's move on. So this is another one too I wanted to bring up. I think sometimes it's a really important one, and I think sometimes again it sort of gets lost a little bit. And I think sometimes parents or caregivers and even individuals you know, that have autism sometimes don't always think about this. But you know, one of the questions that has come up quite a bit is for kids who are, you know, going to need ongoing support with their healthcare needs, even as an adult, including, you know, help making some of those medical decisions. You know, parents have asked, can they still accompany their child to an appointment? Can they still speak to their doctor about medical care? Are they able to request medical records and get test results, or give consent for medical treatment? And so this is where I think, some of those topics around, um, medical powers of attorney or advanced directives, or even some types of guardianship. It doesn't always have to be full guardianship. There are, other sort of partial guardianship options as well. But I think it's important to kind of start thinking about those situations, and sort of looking at, you know, is your child able to communicate their wants and needs? Are they able to, sort of understand consequences to some of the decisions that they might be making around their health and medical care? So I don't know if, I'd love to hear what your thoughts are around these situations, or what your experience has been. I, had even talked to a family who, they were moving into a new practice, and it was a new physician. It was a new practice. They didn't know the family. They didn't know the patient. And so they started asking the parent about, I think we sort of need to talk about this. Like, is this something where, are going to continue to sort of make medical decisions, and be present for these visits? This particular individual was higher functioning, and so it was, I think, on that physician's part, it was a valid question, to bring up and address, as to how they were going to be going forward, and had there been any talk or discussion or arrangements in terms of, guardianship or advanced directives. So if, I just would love to hear what your thoughts are around that, what your experience has been around that.
Go ahead, Tisa.
I'm sorry, was this question for me? I apologize.
Yeah, sure. Yeah,
So,
no, I'd love to hear.
I apologize.
Yeah, no worries.
So my experience around this, in implementing the 6 core elements of healthcare transition, this is an essential part of planning, right? And when completing those assessments, and I will say there are assessments specifically for youth with developmental disabilities, intellectual disabilities, autism spectrum disorder, that can be applied and used. And that helps guide and shape my discussion regarding the level of support or shared decision-making for any individual young person. It's not cookie cutter, it's definitely an individualized basis. So when should these questions, or when should, these discussions occur? Typically in my practice, we're starting these conversations around 15, 16 years of life to see, do we need other services? Do we need neuropsychological assessment to help us guide us in our decision? But we want to start early, and not wait to what I've seen time and time again. You have that 19, 20-year-old mom still bringing them. There's no guardianship. There's no legal power of attorney. It's my mom, and this is my child, and this is what I do. But legally, while we may have been doing that in a pediatric approach, when you go to an adult medicine, it's a hard stop, and they won't see the mom, and you are shut out, and you don't have access to the medical records. So, when a child will need help making medical decisions, the way to evaluate and assess that is as early as possible. And I'm doing that around the age of 15 and 16, so we can start with those plans. So that when you're looking at that structured healthcare transition process, when that young person leaves my practice, all these discussions have already occurred, and the package, so that we can communicate that to the adult provider, and they're aware of what level of support or guardianship, shared decision-making that's already been established and discussed. So they go to the adult provider with this already taken care of. The adult providers have told me they become really frustrated when they get these young adults who clearly need some level of support, but they are having to figure that out on the fly. So to answer your question, it can happen. It should happen in pediatrics. It should happen early, around 15 or 16. to get this discussion going.
Yeah. And I think again too, like the time to like figure all that out isn't like when you're there, kind of again, as you said, like it can be really frustrating for a provider who is new and doesn't really know the situation. And so again, I think it's a great example of where, sort of having those conversations early and even having your, your pediatric provider sort of, pass that information along and that this is what's been set up and, this is sort of how, medical decisions and, handling healthcare is gonna go from there. So, yeah, so really important, I think, too. Sometimes we don't always think about, but definitely worth mentioning. So I'll kind of move through. We're sort of getting close to the end, so I do want to just move through a few of these other questions and then kind of wrap up. We'll try and move through a little quickly, but just wanted to cover a few more of these. Is there anything? And again, this was for Dr. Solomon, but if any of you also want to chime in as well, I'd like to get your input as well. But what do you suggest, or what would be helpful, or to for families to bring to their sort of first initial visit with their new sort of new provider?
I'm not, I'll defer to the other doctors here. I just wanted to make a comment on that last question, because this relates to this question, which is power of attorney and guardianship can't occur before you can start the process, but until the child turns 18, if I'm not mistaken,
You're right.
It's not official, because you don't become an official adult in the eyes of the law until 18. And so I think a lot of parents have questions about, should I bring this guardianship or should I bring the power of attorney information, I think, to your first visit, because that has everything to do with consent. I don't know how early that can be done, Dr. Johnson. Maybe Dr. Modine, I could answer that question. But I know that a lot of my families are grappling with this. Is when to do this exactly. You may talk about it earlier, but when can you actually get it done? How long does it take? Which is different than like Social Security income, because I think when you go to your new physician, these are big issues. Does the adolescent, young adult have consent? Do they have power over their own body? These are really important. The other thing I would do is just make sure that you do have this profile on your child, their, kind of their preferences and their big fears, and not to mention, of course, their medical records. But
yeah, I would stress that. I think the legal documentation is key, and as someone who kind of supports parents through that process, it is a process that takes time, both in terms of obtaining all the documentation that you need to go through the process. And I know that the Alliance is, I can't remember if you did the session already or it's coming up, but just to give a plug in for that session, because it seems straightforward. It's not as straightforward as it seems. There's lots of options. You do need to be kind of well aware of those. And gathering the documentation in time. So, there are some individuals who you're going to need it like right at 18, right? Technically, everybody needs it right at 18, but, if your child is more medically complex or could get hospitalized or end up in the ER, and if you don't have the sufficient documentation in time, that is going to lead to a very challenging situation. The same is true for medication consents and things like that. So I would say that is a really important piece if you are going to be utilizing a power of attorney or guardianship or partial guardianship or any of those things. That is definitely something you absolutely need. The other things that I would mention would be, thinking about, your child's medication history, in particular if they're using controlled substances of any kind. It's going to be really important that you have that documentation to bring forward to your new physician, as well as any prior medical history that could be relevant for them, including in thinking about, the other thing that's a little bit different in terms of adult medical care, is when you had been seeing your pediatrician, you may have been thinking about and talking about family medical history that had occurred in childhood. And so now it's going to be important for you also to kind of rethink about family medical history that occurs in young adulthood and adulthood. So you may not have like thought through that completely. So to make sure that you have a good understanding of what are the medical conditions that occur more commonly in your family, and making sure that your new physician is aware of those.
Yeah, for sure. Those are all really, yeah, really, really good, good points. And I think as we're kind of getting ready to wrap up, and this sort of goes along with this next question in terms of options for healthcare coverage once, your child turns 18, and along kind of with some of the options for um, the types of guardianships or advanced directives or power of attorney. If you have specific questions related to this, please reach out to one of our navigators, because we do have folks that can help with this. We have an insurance specialist on staff who kind of knows the ins and outs of insurance options. If you have, a special needs child once they turn 18, and then we also have some resources that we can direct you to if you have specific questions about guardianship and, healthcare power of attorney, and things like that. And then we talked a little bit about some of the resources that are available. I think Got Transition is amazing. Again, if you haven't, seen it or you're not familiar with it, I would definitely encourage you to check it out. It's gottransition.org. And I believe on the town hall website for the healthcare session, there's a whole list that has been put together that has just a ton of resources around a lot of the questions and topics that we talked about today. So I just want to thank Dr. Solomon and Dr. Johnson and Dr. Muhaddin for joining us today. It was really, really, really great discussion and dialogue, and I really appreciate you taking time out to do that and to join us. And for the folks who are still on the webinar, we are going to be sending out a SurveyMonkey questionnaire that you will should be getting shortly, and we would really appreciate it if you could just fill it out, and any feedback that you could provide for us would be great. We would definitely appreciate it. And again, we want to thank Karen Kalina Wilson Smith Bauer and the state of Michigan for making this webinar possible, allowing us to bring this to you and put this together for all of you tonight. And again, we mentioned several times throughout the talk, please reach out to a navigator. I know we weren't able to get to everybody's questions that came through the chat, or if you have, kind of want some additional information on top of some of the things that were discussed, please reach out to one of our navigators. They're more than happy to talk with you and work with you and get you the guidance and direction and the answers to your questions. You can reach us at navigator@aaomi.org. You can email a navigator directly, or you can call 877-463-AAOM. You can also access us through the website as well. So yes, again, thank you all of you for joining us. It was a really, really great webinar, and Again, thanks so much to all of our panelists for sharing your words of wisdom and your knowledge and your experience. We definitely appreciate it. So again, please don't hesitate to reach out if you need anything, and everybody have a great evening.